Hello, everybody. Today, for the medical engineering final project presentation, I'm going to talk about my project. So, my project's title is Establishing Pain Scale Correlation in Diabetic Neuropathic Mouse with Nerve Conduction Studies and Mechanical Allodynia, and apply in the dosage estimation for transcutaneous electrical nerve stimulation as a therapy. So, let me explain what my project actually is doing. So first, let's talk about the diabetic neuropathy. So diabetic neuropathy is a common diabetic complication of diabetes. So according to the Worldwide Neuropathic Foundation, diabetic induced or diabetics induced neuropathy is the leading cause of all the neuropathy. And when you have this diabetic neuropathy, you have some foot pain or reduced sensitivity in your legs or peripheral organs. So in my research, I aim to establish this comprehensive pain, to establish a pain scale for this diabetic neuropathy in animal model and optimize the electrical stimulation dosage as a therapy based on the diagnosis I have gained before. So what is the significance of this project? So as I have said before, so diabetic neuropathy has caused a lot of chronic pain and reduced the quality of patient life. So if we have this established pain scale, it will have us to better understanding the disease and also how to cure or treat this one. Maybe the cure is not possible, but managing this pain with this effective electrical stimulation, we need to know the exact amount of dosage we should do for this program. So currently there are no established research that quantify the diabetic neuropathy or the pain profile. And if we don't have this quantification, we this application of this dosage for this electrical stimulation is purely based upon trial and error. So the significance of this research is I want to establish a profile or a correlation between the disease progression or the pain and the dosage for this kind of reduction of pain. So the goal of this project is to first to establish this pain scale by various amounts of imaging and other nerve conduction studies. For imaging, am focusing on laser speckle contrast imaging. So uh, some previous paper that has been previously stated that diabetic neuropathy has a reduced blood flow, causes reduced blood flow in your peripheral organs, which might be a passive uh, cause for your pain. So I want to see the exact amount of changes in this blood flow in the mouse paw so that we can have a better correlation for that one. So utilizing this kind of diagnosis, I want to have a final dosage optimization or the dosage estimation for this diabetic neuropathy. Now, for this proposed, I have to do the diabetic neuropathic induction, so which can be done by the STZ model. So STZ is streptozotocin, but based on the research and background that I have found, the combination of nicotinamide and streptozotocin injection causes the better accumulation of these type 2 diabetics and diabetic neuropathy in mouse. So for my animal model, I'm gonna use this animal model with the combination of streptozotocin and nicotinamide injection to induce the diabetic neuropathy. So not only the diabetic neuropathy can be verified for Von-Frey test element, we need to do the blood glucose level testing. And based on the protocol, I have found that it is better to have the exact type of blood glucose concentration over time with Von-Frey test to have the better established diabetic neuropathic model for in mice. And now, as I have said before, in the LSCI imaging, so I want to do this LSCI imaging for find out the exact amount of blood flow changes in the mice hint paw so that we can have a better diagnosis and alternation. And comparing these blood flow patterns between healthy mice and those with the diabetic neuropathy, we can establish the potential alteration in the perfusion associated with this diabetic neuropathy. And finally, the approach will be like this. So I want to establish this model. I want to do the nerve conduction studies and mechanical allodynia along with the laser speckle imaging. And with that, I will do the data analysis and correlation. Finally, from that one, I will do the dosage estimation for the electrical stimulation for this as a therapy. Finally, there will be some alternative approaches or pitfalls. So the potential issue that arises from this research is that variation of individual mice response can be different for each mouse. So I will find out exact amount of variation we using many kind of machine learning method to establish this model. Also, I am considering immunohistochemistry and other cytokine assays to have the better baseline qualifications. So this is all for my project. Thank you all for listening. And if you have any other questions, please and feedback, please feel to ask or reply. Thank you so much.